Well, a shoulder dislocation is quite common, and it occurs when the main ball of the shoulder comes out of the socket, comes out like so. And that's, as I say, it's quite common. It's normally in younger people, perhaps teenagers, early 20s, 30s. It's a little bit more common in males than females just because of certain sports. And certainly sport does predispose to shoulder dislocation, such as rugby or other high impact activities. When the ball comes out of the socket, it creates a pattern of injury. So the ball slides out of the socket and it creates an injury to the front of the socket and the back of the ball. The most common way the ball is going to come out is to the front. Sometimes it goes out to the back, but most commonly it's to the front. And that's because the arm is going backwards, which forces the ball forward. So if somebody is tackling at rugby, the arm goes backwards, the ball comes forwards, and it creates the dislocation. And sometimes the dislocation will go back into joint very, very quickly. Sometimes it can be put back at the side of a pitch or in a sporting environment. But often patients need to go to casualty and the shoulder is reduced. The ball is put back in that environment. The injury pattern that is caused is quite obvious. So as I say, the ball comes out, and as the ball slides past the front of the socket, you get a little chip shot off the back of the ball. But the other major component relates to a ring or a tire that is running around the socket, and that is called the labrum. So the ball is in the socket is quite shallow. So we have a tire that grips the ball a little bit more. So if the ball comes out, it will tear the tire away, and that tire is called the labrum. And that's the pattern of injury that we see when people have dislocated. In terms of diagnosis, obviously it's quite obvious for most people. Where if you go to casualty, they'll generally take an X-ray of the shoulder out, and then once another X-ray when it's put back in. But the investigation thereafter is to do an MRI scan, because you want to determine the extent of the injury and how bad is it. When it comes to then treatment, the treatment varies with age. It varies on the type of dislocation, and it varies on what people want to do with their shoulder in the future. So we know that young people, say age 17 to 20, if they dislocate their shoulder with trauma, then there's a high chance that it's going to dislocate again, maybe 70 to 90%. So that individual may be more likely to need a surgery than perhaps somebody who's in their 40s or 50s, where we know that the chance of re-dislocating is much less. So in that individual, it might only be a 15% chance that it will re-dislocate. The slight rider to that, though, is as we get older, other injuries can occur in the shoulder when we dislocate. And those injuries that are the tendons in the shoulder, the ropes that lift us and rotate us, called the rotator cuff. So as we do get older, the chance of tearing one of those tendons goes up. It's very uncommon in the young person, much more common in the older person. But again, an MRI scan under those circumstances is going to be helpful and going to help with a diagnosis.